Hi, everyone, and welcome to What's Up, Doc. It is our weekly broadcast where we provide an opportunity for patients to ask a physician their questions, their burning questions live. Today, we have a very special guest. We have Dr. Kumar Madassery. He is an interventional radiologist at Rush Hospital in Chicago. Very lucky to have you. Busy, busy day for you out there in Chicago. Lots of cases today. You're still at the hospital, still seeing patients. Thank you so much for taking the time.
No, thanks for having me. I'm sorry I'm late, but this is always a pleasure to connect, and I love what you guys are doing and what you've done. So, all I can do is be available.
Oh, no, we appreciate it. Any highlight from today or any lessons that are worth sharing that were learned today, either by you
Yeah,
or by a patient?
interesting. So, my first case today was a patient who I did what's called a deep vein arterialization, a DVA. On this patient, I did this about 6.5 weeks ago on a patient who was told from another facility that there's no options left and that he has to wait for a major amputation. And, sometimes that's reality, but some of us are doing this connection between an artery and the vein from the inside and hoping that if it survives and it can last a month or two, that we start waking up and forming new vessels in the foot. So I did that procedure 6.5 weeks ago, and I saw him in clinic 2 weeks ago. He was jumping for joy, saying his rest pain's gone, but we're still kind of watching and waiting to see if his blood flow gets better. He goes, also, I'm going to Boston for a week. I said, okay, I have some friends out there. If something happens, let's keep a close eye on you. And I said, I am worried about checking your DVA to make sure everything's okay. I want to bring you back in. So he comes back from Boston, still feeling great. I did the angio today, and the DVA is down. Turns out he was feeling some weird shoulder pains, so he stopped his Plavix. He thought his Plavix was causing some shoulder pain, which, who know, everybody's reactions can be different. And he didn't think much of it. And the thing with the deep vein arterialization is if it shuts down, you won't feel the symptoms that you do when your normal artery shut down. So sometimes you don't know that it shut down. So he didn't know, and so I had, luckily I was able to reopen it. But what I noticed was, even though it's only been 6 weeks, he already had awakening of arteries in his foot. So he is on the road. So luckily we were able to open it back up, and I'm going to hope that another few weeks he can get his toe amputation and try to avoid the major one that he was guaranteed. So again, we don't know. This is still a shot with a lot of prayers. But the key was, he says, I feel so bad. I should have called when I had this shoulder pain and asked what I should do instead of just stopping the medic. I didn't think about it. Even though we counseled, we talked about it. It's hard when you're dealing with so many things. I totally get it. So that was a good learning lesson this morning, is to keep telling them all the different things. Call us before you stop something. That was case number one this morning.
Isn't that interesting where you would think it would be Captain Obvious in a sense that you should always continue to take your medication unless otherwise indicated by your physician. And if you think you are having a reaction to that particular medication, to always, always, always get on the phone with the doctor or the office and say, hey, I'm experiencing these symptoms. I don't know if they're related. Can we have a conversation about this?
You
So
know,
important.
he's been, before we did the DVA, he was sitting on a recliner sleeping most days because of pain and his wounds. And so the last 3-4 weeks he's been sleeping in a bed comfortably. And I think sometimes your mind thinks things are great, and you start focusing on normal life again. He goes, oh, I got some shoulder pain, it must be the new med, not remembering we had a lot of conversations about how important it is to stay on that right now. And even with the medication, could he have had a problem and shut down? Absolutely. So it's just, we can only optimize what we can and try to fight for what we can. So it's, knock on wood, the first one today was a recovery for now. So we'll see. We'll still seeing how that one will go.